this report by Macmillan today is actually good news for the patients I treat and around the country. It shows that if you exercise regularly after your diagnosis, you will reduce the risk of serious complications of chemotherapy and radiotherapy. But more evidence is emerging now that you can actually reduce the risk of your cancer coming back if you continue that exercise for the long term. First of all, it keeps the weight down. Gaining weight is a big problem amongst patients I see. There's actually chemicals being formed in the blood when you exercise, and these chemicals have a direct anti-cancer effect. But also importantly, things like reducing fatigue, reducing anxiety, reducing depression, and all those things have improved the well-being of a patient, and it gives them a stronger position to actually fight their disease. The problem is that when you're on cancer treatments, as you're aware, it's very difficult to motivate yourself to exercise. The survey produced by Macmillan shows that over 80% of patients do not exercise enough. And over 60% of their clinicians don't advise patients to exercise, mainly because they don't want to. Well, part of the Macmillan program is to get a team of experts together, physios, psychologists, and actually come up with strategies to form a plan. And I think the initial thing, apart from informing people about the data, is actually to develop a team of professionals who can sit down from the diagnosis and start introducing the concept of exercise early on in the process. When I refer one of my patients for an exercise program, some of them prefer to actually exercise on their own, maybe walk briskly around a park, but others, like you saw earlier, prefer the bonding of a team exercise with like-minded people who also want to help themselves, and that actually works even better. After you finish the initial treatments, the golden figure seems to be about 3 hours a week of vigorous exercise. Getting a bit of a sweat up is what you should be aiming for.